Okay, let's look at dose response curve in more detail. You may want to look through this material in the text. To start with, dose response curve is percentage of response of whole population as a function of dose. If we talk about toxicology, very common is lethal dose. So 50% of population will die receiving this dose. For humans, very common parameter instead of that will be toxic dose, TD. That will be not death, but obvious signs of poisoning. Mm. Usually 50% of people dead is very pessimistic outcome. Still, you can see that at much lower concentration you still have visible number of negative effects. Now, the same type of curve will be for any kind of response. It can be for positive responses as well, so it's very general. That's reaction of your receptor on agonist. Reaction can be toxicological or reaction can be positive. The curve is still the same. In some cases, when you have several receptors, you may have more complicated picture. So for example, you have usual dose response curve A with LD20 that is much lower than LD50. Curve B perhaps have several receptors that respond in parallel. So looking at LD50, it's less toxic than compound A. But if we look at LD20, so 20% affected, you'll see that compound B is far more dangerous. So looking at only one number as LD50 or TD50 will not give you the whole picture. Would be nice to have the whole curve. So you may have two curves when you have usual drug. First curve is to effective dose, so something that gives you positive response, curing response. So this particular compound at 30 milligrams per kilogram dosage have 50% visible positive response. However, at twice larger concentration, you'll have 50% of population die. So you can see that you have very narrow interval of positive action. If you slightly overdose this compound, you'll have death as a result. Well, again, it can be not LD 50 but TD 50, more optimistic results still. Here this distance is very narrow. Ratio LD50 to ED50 we name therapeutic index. If this therapeutic index is small, say less than 2, the compound is fantastically dangerous. That happens, for example, with several cancer drugs that work at the very edge of poisoning. Good compounds are very special compounds that are very safe, may have therapeutic indices of thousands. One of such compounds from illegal drug story is a cannabinoid group of compounds where LD50 is fantastically high number. It's very difficult to poison to death person with marijuana. Still prominent psychotropic effect is visible at much lower concentrations.